Good afternoon and welcome to our Careers in Science lecture today. Our speaker is Julie Burt, and she is going to talk to you about her career as a physical therapist. Her talk is entitled Physical Therapy, Moving and Grooving. Thank you so much, Julie, for being here with us today.
I wanted to give you a little bit of information just about my background. So I was actually born and raised in Charleston, South Carolina, and went to the University of Georgia my freshman year. I was a pre-med major. I was going to be a pediatrician. That's what I wanted to do. And honestly, my mom is a nurse. And so as we were on the phone my first semester of my freshman year, talking about, now this is back in 1989, back in the dark ages, but that was the time where healthcare was really starting to shift, where you were starting to see that physicians were spending less and less time with their patients. And I remember saying to my mom at one point in time, I said, I don't want to be that person that, patient comes in and I'm with them for 5 minutes and I give them a diagnosis or a prescription, and then I refer them to somebody else. And I said, I really want to be the person that evaluates, and I do the treatment, and I'm there for the journey, and I'm helping them reach their goals. And so that's when I started doing some research and kind of landed on physical therapy. And so at the time I did some research on some different physical therapy programs. And as much as I loved Athens, I really kind of was focusing in on the Medical University of South Carolina. So my sophomore year, I transferred to the College of Charleston because at the time those two programs were working together. And so my sophomore and junior year, I spent at the College of Charleston. And at the time, I was telling Dr. Johnson earlier, you were able to complete your undergraduate work in 3 years if you could, and then you could transition into physical therapy school. Back then, and it is still extremely competitive now, but back then there were very limited number of programs and the class sizes were extremely small. So I was very excited when I was admitted into the program. So again, I graduated with my Bachelor's of Science in Physical Therapy and my Master's degree in Health Science in 1995. And I've been a PT for 27 years. So I wanted to talk a little bit about some of the education that you will do as an undergraduate in your undergraduate degree or in your undergraduate program in order to prepare yourself to get into your graduate program in physical therapy. So obviously you're going to have your English, you're going to have your math, algebra and above, you're going to have your statistics. One of the areas that people don't realize is actually a focus is psychology. So you're going to have a little bit more of your psychology classes. But one of the reasons that this is called Careers in Science is obviously because a big focus in your undergraduate is going to be chemistry, physics, biology, anatomy, and physiology. A little side note, I remember being in physics and, talking about force and fulcrums. And I was thinking to myself, I'm like, why do I need this for physical therapy school? And when I got into gross anatomy, which is in the first semester of your graduate program, or at least it was for me, I remember we were looking at muscles and how the muscle pulls on the bone and how the joint moves. And we were talking about force generation and, talking about angles. And I was like, light bulb moment, that's why I needed physics. So also you'll have the opportunity to take some elective classes, and some of the areas that I think are really important if you're thinking about going into this profession to focus a little bit on some of those electives. Definitely take a communications class, whether it be public speaking, any type of communications class, because obviously you're going to see that that's going to be a big part of our profession, is that ability to communicate with the patient, the family, and other healthcare professionals. Also biomedical sciences, human growth and development, and then social work. And you're going to hear as we go on today why that's important as well. So your PT curriculum is going to focus on preparing graduates to examine patients with impairments, functional limitations, and disabilities, determine diagnosis and prognosis within the scope of physical therapy, design, implement, and modify therapeutic interventions, promote prevention, wellness, and overall health, consultation with patients, clients, and other healthcare professionals, screening to determine the need for further evaluation. You'll find in our profession that the way healthcare is moving, that this is something that we're seeing more and more, where we're being called in to screen a patient quickly to determine whether we feel like that patient needs a further evaluation. And then educating patients and the public and other healthcare professions about our profession. This has been a big focus in physical therapy for many years now, and we're now starting to see that many med schools are starting to talk more about therapies in their curriculum, because we've really, as a profession, made it a focus to educate the physicians and talk to them about what we do. And then research and administration are two other areas that you're going to be prepared to do. Okay, so one of the really exciting things about physical therapy school and the graduate program is right now in your undergraduate, you're in class, you're doing labs, you're in more class, you're doing labs, you're in class all the time, right? Well, when you get to physical therapy school, one of the really neat things about it is that you'll do classwork, but then you're going to go out and do clinicals. Okay, so you're going to spend maybe 10 to 12 weeks in doing classwork and labs, and then you're going to move out and you're going to do a clinical rotation or internship. Then you're going to come back into the classroom. You're going to learn some more. You're going to go out and do a clinical internship and take that knowledge that you're learning and apply it. So it's not like you're going to go to school for all these years and then all of your clinical rotations are going to attach onto the end. They're going to be interspersed in what you're doing in your curriculum, okay? And typically, you're going to see in most programs that you're going to need to have acute care experience and outpatient experience, get some experience with orthopedic and neurological patients. But towards the end of your clinicals, your long-term ones, you're really starting to be able to focus in a little bit on what you might want to specialize in. So for me, my long-term clinicals were in pediatrics. So when you graduate, you'll be prepared to work in a variety of places such as hospitals, rehab centers, homes, private practices, skilled nursing facilities, schools, corporate and industrial health facilities, fitness centers, sports injury treatment centers, and education research centers. You will have a job. So you can see that physical therapists have definitely moved into such a variety of places that finding a job is not going to be an issue. So the physical therapy profession is now a doctorate level, entry level doctorate program. They no longer offer a master's level program. Everything has moved to an entry level doctorate program. Most programs, you would do a 4-year undergraduate degree, get your degree in biology or biomedical science or kinesiology or something along those lines. Making sure that you're working with your advisor to make sure that you have all the prerequisite classes that you need for grad school. And then graduate school is typically 3 years. So you're going to do your 4 years of undergraduate, receive your bachelor's in something, and then move on to your graduate program, which will be 3 years. There are programs out there that actually have a continuum of bachelor's to doctorate, and those can run 6 to 7 years, but there aren't very many of those. So most of them are just graduate programs. So once you have graduated from your PT school, you will need to take the National Physical Therapy Examination, the board exam. And once you have your license, after you have your license, you'll need to do 30 hours of continuing education every 2 years. That sounds like a lot, but quite honestly, you're going to graduate from PT school with quite a bit of knowledge. And a lot of that is general knowledge. Your continuing education classes really allow you to pursue maybe some of the areas that you're more interested in and dive deeper into those areas. So for many years, I actually started the aquatic therapy program in Greenville for pediatrics. And so for many years, I spent time attending my continuing education was in aquatic therapy. So you'll find that it sounds like a lot, but it really isn't after you get into those years after your graduation. Okay, so now that we've discussed all the education part of everything, let's talk about what does a physical therapist do and what are some of the different places that you can work? So that's a loaded question at this point because physical therapists are definitely, that's a like I said, it's a loaded question. We cover a lot, but I'll kind of give you just a basic overview. As a PT, you're the one who will work directly with the patient on maximizing their functional potential. You are going to have the ability to work from pediatrics to geriatrics. So you're going to cover the lifespan. Your role is to either return function. So say you've had somebody who's had surgery, your goal is going to be to return to their, return them back to the function that they had before, or to maximize their functional potential. Okay, so you're going to want to maximize what they have available to them. I'm sorry, those are my dogs. Okay, so let's talk about just a few of the settings that you can work in. So one of them is going to be the acute care setting. So that's your hospital system. So typically in a hospital system, there are teams. Okay, so you're going to have your medical surgical team. You're going to have your orthopedic team that might work a little bit more with patients who've had hip replacements and knee replacements. You're going to have your neurological team that's going to work with patients who've had strokes, traumatic brain injury, spinal cord injury. You're then going to have your trauma ICU team that's going to work primarily with the trauma patients as well. So you can see that within that hospital care setting, typically there are teams. Now, I will tell you a little funny story. So one of my very first classes in physical therapy school was med-surg. It was medical surgical. And so the teacher posts this picture of a wound up on the screen. And I looked at the girl sitting next to me. I was like, we don't do that. Like, don't nurses do that? And it was funny because then the teacher immediately said, she said, now you probably are wondering, why do we do this? I thought nurses did this, but actually in a lot of settings, physical therapists are the ones that do wound care as well as burn care. So that's kind of the acute care setting, kind of wrapped up there. So let's talk a little bit about the rehabilitation setting. So the rehabilitation setting is, so after acute care, if the patient is not quite ready to go home yet, then at that point, they're going to transition into the rehab setting. And this is really where you're going to start to see your therapies come to the front lines, okay? So you have your acute care setting where the focus really is medical, right? We need to make sure that these patients are medically stable. When they transition to the rehab setting, because they're not quite ready to go home yet, they're not safe to go home, that's where your PT, OT, and speech are really coming to the front lines, okay? And your job in a rehab setting is not just to make sure that the patient is ready to go home. So working on sitting balance, transfers, gait training, those types of things. It's also patient or family and caregiver education as well. So your role as a PT is not just with the patient, it's with the family and the caregiver as well. So you're going to be teaching that caregiver, what is the safest way to transfer this patient from the bed to the chair? Okay, or what level of supervision do we need to make sure that this patient has when they go home so that they're safe? So that rehab setting is really where you really start to see PT come into the forefront. So let's talk a little bit about the outpatient setting. So this is where you start to see that your therapists are starting to kind of get a little bit more specialized, okay? So your outpatient setting can be a private practice. It can be a sports injury outpatient center. It can be a pediatric outpatient center. But let's just say it's a general physical therapy outpatient center. And they get a call and it is, I've just been recommended for physical therapy because I've had a back injury. So typically you may have Sally over here she really has done a lot of her continuing education and focus on patients that have had back injuries. So typically that patient is going to move over to Sally. Then you might have a person who calls in and they've had a stroke. Okay, and so maybe Tom over here he's really done a lot in stroke rehab. So that patient may gear a little bit more over here to Tom. So your outpatient centers are really the time where you're starting to see that some of the areas that you have specialties in, you're kind of finding your niche a little bit more as well. I want to talk a little bit about the pediatric world, only because we need pediatric therapists out there right now. As I said before, I'm not getting any younger, and so my body's ability to get up and down off the floor is becoming very limited. But we have a high need with our pediatric population for physical therapists. So I'm hoping that maybe something that I say or the story that I tell will maybe tip you and get you a little bit interested in that. And obviously, if you have questions afterwards, to please make sure that you reach out to me about that. I've been a pediatric physical therapist since 1995, since I graduated from PT school, so 27 years. And as a pediatric PT, you're more a specialist in the age group. Okay, so you're not necessarily, because as a pediatric PT, you're dealing with orthopedic impairments, you're dealing with neurological impairments, you're dealing with developmental delays. So you're more of a specialist with the age group themselves. Okay, so you're getting to see the whole trajectory, and you're treating the whole child. So just to give you a little bit of an overview of just the different areas that I've worked in as a pediatric physical therapist, when I graduated from PT school, I moved to Greenville. I actually worked at the Children's Hospital in acute care. I worked in the neonatal intensive care unit while I was there. And then I worked in the outpatient center, which was called Kinetics, and I did outpatient pediatric physical therapy. And that is where I started the aquatic therapy program as well there. When we moved to Fort Mill, I actually worked in the school district for 14 years. And so I've been able to work in that setting. And now I'm back in an outpatient setting at Chit Chat Therapy. So you can see that just across the one area that I've specialized in, all the different settings that I've had the opportunity to work in. So, again, I often will say I was a clinical advisor when I was in Greenville, and I used to love having PT students who would come in and work with me there. And I would often tell them that one of the things that always to keep in mind, if you end up going into this profession, then in the 27 years that I've been doing this profession, not a single child has come through the doors of the clinic that has come right out of my textbook. Okay, so you as a physical therapist, you're going to get the knowledge that you need in physical therapy school, but you're really going to need to be the type of thinker who can apply that knowledge, who can think outside the pages of your textbook. Because I can assure you that case scenario number 23 from your textbook, you're never going to see that person. Every person is unique and an individual when they come through those doors. And in 27 years, I've never seen one of them come in that came straight out of my textbook. Okay, so let's talk a little bit about working with other professionals. And this is where your communications degree is going to be, or communications classes are going to be really important. So as a physical therapist, you're going to learn very quickly that you're going to work with many different professionals. The phrase that it takes a village is definitely appropriate when it comes to patient care. So as a physical therapist, if your goal, which it always should be, is to provide optimal patient care, chances are likely you're not going to do that alone. Okay. You're going to have a team, and there's going to be a team involved with that patient so that you're all providing the optimal level of care. So let's talk just a few different areas and professions that you may work with. So one of the big, two of the big professions that you'll probably find yourself working with are occupational therapists and speech therapists. I do many co-treats in my pediatric world with occupational therapy and speech therapy, because oftentimes 4 hands are better than 2. And somebody asked me at one point in time, well, why would you ever work with a speech therapist? Like, what is the connection there? Well, take a stroke patient, for example, after they've had a stroke. And maybe my goal is, obviously, maybe that patient has lost their ability to sit. So I'm working on sitting balance, trunk strengthening, trunk control. Well, think about, what does the speech therapist need? What does a patient need in order to be able to have sound production? They need breath support. And that comes from that trunk control. So PTs and speech therapists actually do quite a bit of co-treating as well. Also, you will likely have direct communication with physicians. This may be for the reasons of post-surgical treatment protocols, weight-bearing restrictions, but mostly collaborating on your findings from an evaluation and determining whether other referrals are necessary. 2 weeks ago, I had a patient that came in and I did an evaluation on that patient. And after that, and again, remember, these doctors are only spending a very, very short amount of time. So oftentimes they're referring to us to dive deeper. Okay. And to get back to them, you always need to stay within your scope of physical therapy. But I contacted that pediatrician back and said, I really believe that this child needs to be referred to an orthopedist as well as to a neurologist. And so we had a nice conversation and really trying to provide that support for that patient as well as for the parent. Okay. And then prosthetists and orthotists. PTs are very involved in orthotic assessment. For many of my pediatric patients, I use orthotics to prevent contractures, for them to be able to stand, to walk, for positioning. So we're working very closely with orthotists to make sure that we're getting the right orthotic. Some people think about those as their little braces for their feet. So we're working very closely with orthotists for that. We also do prosthetic training post-amputation. So physical therapists are the ones that do that as well. So you're also working a lot with prosthetists, because you're going to be the one that when that prosthesis comes in, you're going to be the one that's going to be teaching that person how to stand, how to walk on that prosthesis. So prosthetists, orthotists are a big group that we also work with. Rehab technicians. So rehab technicians are your equipment suppliers. So the title of this lecture is Moving and Grooving, and I'll tell you how I got that title in a little bit. Because as PTs, we want our patients to be able to maximally access their environment, and that includes home, school, community, and work. And so for some of our patients, this is going to involve the use of equipment to be able to access their environment. So we work very closely with rehab technicians on the ordering of wheelchairs, walkers, standers, gait trainers, shower and toileting systems, vehicle conversions, and home accessibility. Okay, so having a good working relationship, even if that patient's only going to need that walker temporarily, having a good working relationship with your equipment supplier is extremely important. Okay, so one of the biggest areas that I'm super passionate about, and I want to talk just briefly about, is communication and patient-family involvement. I want to spend time talking about the traits that you are going to need as an individual in order to be truly effective and make an impact in the life of your future patients. It is something that I'm extremely passionate about because our healthcare system has evolved. Okay, and physical therapists are on the front lines of case management, coordination of care, and providing support for not just our patients, but also for their families. And remember what I said at the beginning of the lecture as to why I chose PT over medical school, and this is it. Because doctors are spending less and less time with patients. And often a patient can be seeing multiple specialists, yet nobody takes all of those parts and pulls them together cohesively in the way that a patient and a family can understand. So I have many of my patients, and they're seeing an orthopedist, a neurologist, a physiatrist, a geneticist, a developmental pediatrician, OT in speech. And so although you always need to make sure that you're staying within your practice knowledge, oftentimes you are the ones that might say, you know what, I think that maybe we need to look into getting you linked up with this agency, or maybe we need to apply for this grant because insurance doesn't want to pay for this adaptive bicycle. So let's see if we can get you a grant for that. And oftentimes as the PT, you are really kind of becoming the case manager. Talked to a friend of mine this past weekend who actually does adult spinal cord injuries, and she said the exact same thing. She said, Julie, it's not just in pediatrics, it's in the adult population as well, where physical therapists are really becoming the front lines of that case management, especially as more and more less social workers are going into the profession. So when I received the request from Dr. Johnson to do this lecture with you today, one of the clients who comes to Chit Chat Therapy is a 10-year-old, and he has spina bifida. And so when I received this from Dr. Johnson, I walked down into the gym. He was having therapy with one of the other therapists, and he is the coolest kid. And I said to him, I said, okay, so what do I call this lecture? And he says, well, I mean, Miss Julie, of course you call it Moving and Grooving, because that's what PTs do. They get us patients moving and grooving. I said, okay, so that's the title. He has actually been in physical therapy since he was an infant, and he is 10. Just last week, as a matter of fact, they were looking at manual wheelchair to maybe power mobility for him. So I said to him, I said, I'm having this lecture with people who may be interested in going into the field of physical therapy. I said, what do you want me to tell the students? What has been your experience as a patient, and what do you look for in a physical therapist? Because I think this is very important. He said it's important for his therapist to ask him what his goals are. He wants his therapist to listen to him and to make him a part of all decisions, since it's his life. He also made a very interesting point when he said that some days when he comes to PT, that he might have had a bad day. Maybe a bad day at school or a bad day at home. And he wants his therapist to be understanding that things might happen outside of his therapy session that impacts his performance. Isn't he just the coolest? So that maybe what the PT thought for the session needs to shift. Okay, so if he's coming in, he wants that physical therapist communicating with him. And maybe if she had something in mind today and he's just that his day just really isn't been that great, he really doesn't want to do that. We need to be flexible and learn to shift focus a little bit. So the point is that the only way that you're ever going to help a patient reach their maximum functional potential is to make them a part of everything that you do. And that includes the family. And remember that these patients have a life outside of their therapy session. I think sometimes, especially when we're new graduates and we're coming out of school, I remember giving patients like moms 10 pages, of home programming activities. And then they come in the next week and I'd be like, did you do it? Did you do everything? And they're like, no, we didn't. We had this appointment and this appointment. We only got to this and that. And after I had children of my own, I was like, oh my gosh, what have I done to these parents for all these years? Because you definitely need to begin to understand that although home programming is very important, because you're only with them an hour a day, caregivers are with them the whole week, 24/7, that you do also need to consider that they do have a life outside of the time that they're spending with you. Also, I want to say real quickly that over my 27 years as a physical therapist, that well over 50% of my patients were nonverbal, that they had unintelligible speech or required the use of an assistive technology device for communication. But regardless of a patient's ability to expressively communicate with you, you always talk to them. You always explain things to them and you watch for their cues, because often they'll lead you to understand what they need from you. And this is in an adult population and a pediatric population. Watch for what makes them smile, understand what frustrates them, and also treat them with the respect that they deserve. I'll never forget a treatment session that I had with a child one time, and this has happened to me multiple times throughout my career. But mom and I are, we're conversing and teacher and everything else. And we're thinking, okay, this is the direction that we need to go. And we're in the therapy session. And this child is really kind of showing me through visual and kind of like a attention and motivation that she's really motivated towards something else. And at that point, I sat back and said, yeah, this isn't about me. This isn't about mom. This isn't about teacher. This is about the patient. And she's showing me that even though she can't tell me, she's showing me that she's interested in this. How am I going to reach goals with this child? It's to work on what she's motivated by, right? So if we're working together as a team, she's motivated to reach those goals. So that's extremely important. And always, always, always remember, you do not need to be having conversations about your patient in front of your patient when you think that, that they can't understand you. They can. Right? And so always, always make sure that you're talking to them, communicating with them, looking for their cues, and making them a part of everything that you do. So as a PT, you are going to become the case manager, the social worker, the counselor, and your success will not come from whether you get an A in your anatomy class, but whether you can have a patient who trusts you enough to link arms with you and to reach their goals and what they want to do in their life. And it won't be easy. And I can assure you that you'll need to be in this profession because you genuinely want to apply your knowledge and because you want to apply it to the benefits of others.
Thank you so much.
You're welcome.